Okay, so with the mitral valve prolapse, how does that affect your overall heart health, between now and into the future, depending on lifestyle and other things?
Right. So, whenever we're talking about like valve disease, one thing I always tell people is out of all different types of heart problems, okay? So when I make the analogy of the heart house, people can have wall problems like damage, heart walls. They can have plumbing problem. We call that coronary artery disease. That's what, heart attacks and bypass and stents, when we're talking that's what we're referring to as a plumbing problem. Or people can have electrical problems like atrial fibrillation that can put them a stroke. But the most benign out of all these dysfunction is actually the valve problem.
Okay.
So valves are actually, they're not something, if somebody has a valve leak or a stenosis or a stuck door, it's not like we need to get them into the heart doctor right away because they slowly progress. Now, rarely, as I'm talking about, people can get an infection on the valve. So that's when you hear doctors or dentists making sure that before they do any deep abscess work or deep dental abscess, they want to know from your heart doctor whether there is a valve problem or not, because that bacteria can go, and especially the bacteria that goes around the tooth also has an affinity to grow on the heart. It's called Streptococcus viridans, and so that same bacteria can then start damaging and start eating up on the valves, and then patient can get sick and quickly die. So short of what we call as bacterial endocarditis or infection on the doors, the door disease or the valve disease is a slowly progressive disease. Coming back to mitral valve prolapse, most people don't get into a problem, in the natural history. Some people, as the valves leak, so what's happening is the heart has to pump effectively forward. So let's say it pumps 100 cc's out, but then if the valve is leaking, and let's say 40 cc's comes back, now effectively it has to pump 140 cc's out every heartbeat, because it pumps 100 out, 40 comes in. So now effectively 140. Now as the leak gets more, imagine if 100 is going out and 80 is coming in, now we're talking almost twice the amount of blood it has to engage.
So it makes the heart have to work harder.
Correct. And as it works harder, it's get ballooned or dilated, and then the walls start settling and filling. So as the disease of the door get worse, it puts a strain on the heart itself, and then the walls start settling and they get what we call as congestive heart failure. And that's, so we like to diagnose people with either a valve leak or a stenosis right before the heart's starting to fail and the congestive heart failure symptoms are starting to set in. Right at the time where they're starting to dilate, that's when we say, okay, we call the surgeon and say, all right, guy, let's cut this door out and put a new door in. So when you hear people say, I got a pig valve or a mechanical valve, we're talking about a new door.
And they replace the door.
Correct.
So that it takes the stress off the heart.
So it prevents the heart from going down the path of strain and congestive heart failure.
All right.